if you don't know already, it is Wednesday, and that means it's time for a house call with Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital, for this edition of Wellness Wednesdays.
Yes, Dr. Grill, welcome to the show once again. Always a pleasure to have you. Today we're talking about kind of digestive issues. So let's start with what are proton pump inhibitors and what exactly are they used for?
Yeah. So good morning. So heartburn or acid reflux, very common condition. When we eat food, it goes down the esophagus, the swallowing tube, into the stomach. When it gets to the stomach, it produces acid to sort of break down the food, help us digest. Sometimes a little bit of that acid and food can go backwards from the stomach back into the esophagus. It causes symptoms like a little bit burning in the upper chest or the throat, can be very bothersome to people. So these proton pump inhibitor medications, when you take them, they lower the acid content in the stomach to help alleviate the symptoms. And also they're used for other things. Sometimes if people get ulcers in their digestive system, they're used to help those heal.
Okay, and so how common then are PPIs and are there side effects?
Yeah. So millions of Canadians use these drugs. In fact, in the elderly, so over 65, they're the second most common drug that's prescribed. Yeah, very safe. You know, there is some risk that because you're reducing the acid, you can't break down certain foods, get all the nutrients absorbed. Sometimes there's some bacteria that doesn't sort of get destroyed and you can get some infections. But in general, most people tolerate these very well, no complications.
Okay, and just to clarify, because I just want to make sure everyone's understanding, when we talk about PPIs and over-the-counter stuff, we're talking antacids, right?
Yeah, so these are drugs that are given by prescription. Some of the more common brand names would be Nexium, Pantaloc, Losec, but they're prescribed by a physician in Canada.
So you're not talking about something that you could like Rolaids or something, which I know a lot of people take, and you can like people just munch through those.
Right. Similar thing to reduce the acid, but these are stronger drugs. They're more specific for that condition.
Okay, we're not talking Tums and all that stuff or Pepsid AC.
Right.
Okay, so moving on, there was a recent study suggesting that people taking these prescribed PPIs are at a higher risk of dementia. Is that true?
So there was this study that looked at a database of a lot of people, and they looked at the difference between people that were taking these proton pump inhibitors and those that weren't. And the study concluded that if you were taking these PPIs, and we're talking about for like 4.5 years, so sustained use, there was an increased risk of developing dementia. But there was a similar study done a few months back, similar database analysis that didn't show an association between the drugs and dementia. So we have mixed results. I would say that the study you're referring to was far from definitive to say that if you're on a proton pump inhibitor, you have a high increased risk of getting dementia, and more research is needed.
So, and that's interesting, because is that really the takeaway from this study, that perhaps more research is needed, that you shouldn't sort of freak out and stop taking your PPIs? Is that kind of where you're going?
Yeah, so I think there's a couple takeaways. If people are taking these drugs, and there's many taking them, I wouldn't stop them right now because you're worried you're going to get dementia. But what this study does remind us is that if you're on a medication long term, you should always reassess whether you need to continue to take it, right? Because when people are on drugs for long term, there can sometimes be situations like with acid reflux. Most of the time you can treat it with a PPI for 1 or 2 months, your symptoms go away, you're done. The problem is we overprescribe these drugs in some situations. Choosing Wisely Canada and the Canadian Deprescribing Network did a big education campaign about this a few years ago. Because when you're on drugs long term, there can be risks of things like drug interactions, so you can have negative health effects. You can have dosing errors like in the elderly. And sometimes it increases, obviously, the cost of buying it. The other thing about acid reflux we have to remember is there's non-medical treatments, right? Don't have spicy foods, reduce caffeine and alcohol, don't eat 3 hours before you go to bed. So yes, we need more research. And for those people that are on the drug, if you're eligible to be deprescribed, please see your primary care provider to have a discussion, and don't stop at cold turkey. You could get rebound symptoms. You have to be taken off slowly.
Okay, very important. Dr. Grill, we only have a few seconds left, but we do want to touch on COVID-19. Cases are rising again. I just learned that my father had COVID and someone in our close vicinity also. So what do you have to say about this? What's the advice to the general public right now?
Yeah, so first of all, I hope your father recovers and feels better soon. So again, we're going to have ebbs and flows with COVID-19. I would say that it's not overwhelming our hospitals right now. It's not overwhelming my office. Reminding people, please get caught up with your vaccines. There's a new COVID-19 vaccine coming out in the fall. We recommend people get updated, especially over 65, if you have compromised immune system, if you have chronic medical conditions. And if you're sick, like your dad, please stay home until you're feeling better. And we're going to continue to look at the data, and we'll pivot when we need to.
Okay, Dr. Grill, an important conversation as always. Thanks for making this studio call for this Wellness Wednesdays. Appreciate the time this morning.
Thank you so
My
much.
pleasure.
Thank you.
Appreciate it.
And stay right there. We've still got the long-range forecast plus news, weather, traffic, and all your headlines coming up on CP24 Breakfast.
Thanks again. That was great.
Is that okay?
Yeah.
Thank you.